Good afternoon. Welcome, everyone. Bienvenue, bienvenidos, bienvenidos. My name is James Hospitalis. I'm the head of Earth Medic and Earth Nurse, and I'm very happy to welcome everyone to this second session in the course, Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. I think if you're on this course, you understand that the region of the Americas, Latin America, the Caribbean, North America, Central America, we all face a tremendous challenge in climate change that we are experiencing with the heat, the extreme weather, the sea level rise, etc. And this has implications for people's health and for the operation of the healthcare system. This course is focused on scaling up health adaptation measures to meet that climate change challenge. This is our second session. Why a pilot is not enough, the challenge for health authorities in scaling up adaptation. This course is brought to you by a remarkable consortium of partners, beginning with the Global Consortium of Climate and Health Education at Columbia University and the indefatigable Cecilia Sorensen, Health Canada, ourselves at Earth Medic and Earth Nurse, the Ministry of Health of Brazil, the IAI, the Pan American Health and World Health Organization, and International Institute of Global Health. We're very happy for this partnership. Some housekeeping announcements. There will be simultaneous translation available in English, French, and Portuguese using the button with the globe icon on your screens. So you can go ahead and click on that. As I said earlier, we're on the second session of an 11-course series. Last week, we had a terrific introductory talk on health adaptation in the face of a rapidly warming world. And today we're looking at how do you scale up adaptation? A pilot is not enough. This is a little difficult to read, but you have, and it's in all the languages. You have these materials available to you. Participants at the end should be able to understand the importance of rapidly scaling up climate change and health adaptation measures, describe the key actions that are needed to do that, identify opportunities for increasing health adaptation efforts, and be prepared to work with a broader range of partners, both in the public, the private sector, civil society, academic partners, because it takes a lot of folks working together. The learning objectives are defining and distinguishing between reactive, incremental, and transformational adaptation efforts, identifying the characteristics of successful large-scale adaptation implementation across jurisdictions, and some of the issues in governance, and analyzing the barriers that prevent health authorities from moving beyond projects to system-wide adaptation. These are 90-minute sessions. They will end with a question and answer section. Please, when you have a question, you can enter it in the Q&A box of the Zoom link, and all the video recordings and slide decks will be available on the course website at completion. That's a question we get a lot. Will the video recordings be available? And answer is yes, they will be available. Your attendance, I draw your attention, it's automatically recorded, and your individual attendance is only counted if you join using your personal Zoom link. It's not counted if you join with a colleague's link, and the YouTube videos will not count towards attendance. A certificate of participation is available for those who attend 8 or more of the live Zoom sessions. Remember, there are 11, so you must attend 8 or more and pass a final exam with a score mark of at least 70%, and then you can be awarded a certificate of participation. So it's only for people who use the same email for registration, all Zoom sessions, and the exam. This is an important detail. Please note. We're also having a couple of the sessions, 5 and 9, focusing on listening and learning from case studies that most folks are involved in one way or another. So you can submit your case study, and it can be part of the listen and learn experience with scaling up health adaptations and applications and gaps in current tools and guidance. That's session 9. Finally, you can join our WhatsApp group to receive important course information and reminders. So you have the QR code there. Please go ahead and scan it. We'll also put it again later in the chat. If you haven't already joined, this is a good way to be right up to date with course information. Now, it is my pleasure to introduce our panel for today. Dr. Peter Berry from Health Canada is Adjunct Professor of Geography and Environmental Management at the University of Waterloo and a Senior Policy Analyst and Science Advisor with Health Canada. Dr. Cristovan Barcelos is a Senior Researcher at Fiocruz, the Oswaldo Cruz Foundation, and Professor at the National School of Public Health. And Mary Cameron is the Founding Director of the Ministry of Health's Climate Resilience Unit for the province of British Columbia in Canada. So let me hand over to our panelists.
Great. Thank you so much, James. I'm going to share my screen. And if you could let me know if you can see this okay.
Yep, seeing it fine, Peter.
Okay, that's great. Well, thanks again. And thanks so much to Dr. Sorensen and colleagues at the Global Consortium on Climate and Health Education for this very important course, organizing the course, but also the invitation to participate today. And I also want to thank the Pan American Health Organization and all the other partners for making the course possible. Now, you know, as climate continues to warm rapidly and risks continue to really increase, I think the discussion about scaling up is more critical than ever. And we know there's many international and national studies have indicated that we have to do more to protect health. We've got to go faster to get ahead of the climate change curve. So I'm particularly excited to participate in this session. I've been working at Health Canada for over 25 years. A lot of my activity has been on undertaking pilots. And so I'm really excited to present on moving beyond pilots and also to learn from the other presenters and from the discussions. But before I begin, though, I just want to acknowledge that I'm making this presentation from Ottawa, where I live and work, and it's the unceded, the traditional unceded territory of the Algonquin Anishinaabe people. So today in my discussion, I'll talk about why we need to scale up health adaptation quickly, what it means to really move beyond pilots to build climate resilient health systems, and you know, what are some of the barriers and opportunities to protect health in terms of building climate resilience. And so in Canada, like many other countries, we're really experiencing quite rapid warming and increasing risks to health. And you know, Canada is a very large country. We've got diverse climates, diverse populations, and so we're seeing a really wide range of climate change impacts on health. So, for example, we're seeing an exponential increase in Lyme disease coming north into Canada because of this warming. We're also seeing a lot more frequent and severe extreme heat events, which are, you know, increasing morbidity and mortality, but also affecting health systems. So we've had some health facilities impacted by heat events, operating theaters that have needed to close. And as many of you know, we've seen very severe wildfires in Canada that can really affect health. It can cause disasters in communities and even affect health thousands of kilometers away. And we know that hundreds of people can die in a season from these very severe events. And certainly a lot of health authorities in Canada are concerned about mental health impacts from climate change. So from acute events like floods, like extreme heat, or like wildfires, that can really impact specific populations like youth, for example, but also longer term, more generalized impacts like eco-anxiety as well. So there's a really broad range of impacts in Canada. And some of these events and some of these impacts, these health impacts, have actually been attributed to climate change, things like some wildfires and extreme heat and Lyme disease. And certainly, First Nations, Inuit, and Métis people living in Canada are really uniquely sensitive to the impacts of climate change due to a combination of historical context, cultural aspects, environmental challenges, and social and economic issues that they're facing. So, for example, Northern Indigenous populations are facing increased food security risk because of new challenges with the harvesting, processing, and consumption of country foods. And also climate change leading to the spread of animal transmitted diseases throughout the north and increasing the risk of disease is a concern for the future. And the remoteness and accessibility of health services in many parts of the north can really increase risks from climate change impacts. But there's a lot of very strong Indigenous-led adaptations that we're learning from moving forward as well that can really help prepare communities. And this is actually from our National Climate Change and Health Assessment that our office led in 2022 and really looked at health risks from climate change and some of the vulnerabilities and identified that there are a number of populations in Canada that are really disproportionately impacted from climate change. Older adults, children and youth, people with chronic illnesses, Indigenous peoples, people with disabilities, workers, the poor, socially isolated people. And it really mapped some of the key hazards that we're concerned about onto the population. And you'll see it's a bit hard to sort of unravel this, but you'll see that many of these populations are affected by multiple hazards and sensitive to multiple hazards. And so, this is a real concern because these can accumulate and they can compound and they can have really quite important and severe health impacts for these populations. And so, we know that we can have really severe impacts from climate change, and we've seen this in the past. We've got research on this, and so, for example, Hurricane Maria in 2017 resulted in 3,059 deaths over the period 2016 to 2021. 43.1 million children were internally displaced due to weather-related disasters. And the heat in Europe in 2022 caused an estimated 61,672 deaths. So really quite catastrophic. And so, these are very significant health events that we really need to address. And so, the good news, though, is that we can be effective. We know that we can be effective in terms of preparing for the impacts of climate change. This is a finding from the Intergovernmental Panel on Climate Change, the recent report, Working Group 2 report released in 2022, but also the World Health Organization, and in Canada, the National Health Assessment that I mentioned. But we know we need to move more quickly with our health adaptation efforts, and we need to do so because we have a health adaptation gap that exists in many countries in terms of the efforts by individuals, communities, and health systems to prepare for climate change health impacts. And we know that incremental adaptation is not preparing people for climate change. It's not leading to sustained reductions in health impacts. And existing adaptation gaps are expected to widen, leaving health systems underprepared for the consequences of a rapidly warming world. And really importantly, the accumulation of risks over time threatens health systems with potentially nonlinear increases in vulnerability. So, there's a danger that we'll get behind climate change in terms of some of the impacts at a time when some of the impacts are really increasing in terms of some of the heat and wildfires and things like that. So, in terms of thinking about moving beyond pilots, a lot of health authorities have started with sort of their adaptation initiatives with pilots. And so when we think about moving beyond that sort of stage, I think it's useful to think about incremental health adaptation and transformational health adaptation. And so, incremental health adaptation is really largely the expansion of existing practices. It's often localized and fragmented. often based on limited evidence of coordination or mainstreaming across sectors, jurisdictions, or levels of governance, oftentimes implemented more slowly. And often doesn't exceed or substantively challenge soft limits to adaptation. So it can only go so far in terms of protecting health. Whereas transformational health adaptation oftentimes involves entirely new practices, things like deep structural reform. The adaptations are more widespread and substantial, including most sectors, levels of governance, and actors. And oftentimes it's much more rapid change moving forward and can exceed many soft adaptation limits and approach or challenge even hard adaptation limits. So, can move forward, a bit further in terms of really preparing health systems for climate change. So, scaling up can move health systems towards transformational change. But pilots can be very useful and appropriate for adaptation strategy implementation. So, in Canada, we learned a lot from our heat resiliency project, where we had 4 pilot communities develop from the ground up heat alert response systems. This is when we started our initiative in 2008, 2009. And there was, many useful learnings from these projects. Now, these were actually held in Windsor, Ontario, Fredericton, New Brunswick, Winnipeg, Manitoba, and Assiniboine Health Region in Manitoba. They led these pilot projects. We learned a lot about sort of translating research into concrete policies and initiatives. We learned about how to network with your partners to make these projects happen, but also what's effective in terms of heat alert and response systems and protecting the people most vulnerable to some of these events. And the findings from these pilots, they really helped inform a lot of the guidance documents that we produced on heat health. For example, our best practices guidebook for developing heat alert response systems. So it was very helpful to Health Canada, and I think helpful to a number of communities across Canada. And so our Health Adapt project, the first of which we began in 2018, was also based on a pilot approach. And the goal of this project was really to support local and regional health authorities to build the capacity to undertake climate change and health action. So undertake climate change and health assessments, develop those health adaptation action plans. And there were really many excellent learnings from the 10 projects across Canada. You see them on the map here of Canada. Many excellent learnings from these projects. So we had an Indigenous-led project by First Nations Health Authority in British Columbia. We had some projects in major population centers, bigger cities. We had some in smaller rural health units that were really helpful and interesting. We also had some very focused projects on health facilities. And so a lot of the learnings that came from these projects were sort of distributed throughout Canada, other health authorities, through our Health Adapt community of practice, and hopefully very helpful to them. And we actually had some Health Adapt digital case stories developed as well. So that's one way to sort of provide these learnings. And I know we're going to hear from my colleague Mary Cameron from the BC Ministry of Health a little bit later in this session about some of the excellent work that's happening in British Columbia. And so, in terms of building climate resilient health systems, we can think of scaling up efforts to move us more towards transformative change. And so, for example, moving from early warning systems and supplementing them with more sort of infrastructure, climate smart infrastructure improvements that can reduce exposures of population to things like floods and heat and greening communities in order to do that. And then even moving towards much more fully climate resilient health systems is even more transformative. And so, in terms of how we undertake health adaptation, there are many different ways in which we're doing this, I think, all the time. Many people are familiar with some of the core processes that we undertake in terms of undertaking climate change and health assessments, developing health adaptation plans. These are very, proactive measures. I like to call it looking from the outside in, from the perspective of climate change into the health system. But it's really important to undertake, broader health system planning, mainstreaming climate change into all your health programs. Again, being very proactive, and sort of looking at the whole of health system approach, looking from the inside out. I would consider the health system planning much more transformative in terms of a kind of adaptation, where some of the other activities are perhaps a little bit more incremental. And then we're also engaged because the impacts are increasing significantly from climate change on acute hazard response and recovery types of adaptation. So sometimes this can be involuntary or forced adaptation, where you've got urgent needs in a short time frame, and this can be very reactive if the planning is not sort of advanced enough. And so, we're engaged in different kinds of health adaptation as we move forward, and we need to obviously be improving this and moving more towards scaling up. And so, there are a number of common barriers to scaling up health adaptation that I think a lot of health authorities have experienced. Certainly, we've learned this in Canada, and I'll speak to a slide about that in a moment. So, not having enough information, what works, what doesn't, what needs to change, not having the capacity needed, the money, the people, the expertise. Leadership is really important. You really need that sustained collaboration and coordination moving forward, particularly if you have different levels of government or many partners to bring around the table. And that intersectoral collaboration can be a challenge, bringing colleagues from other sectors like transportation, agriculture, urban planning, disaster management, into the discussions about health and about moving faster in terms of how we undertake some of these measures. But I actually think a really interesting possible challenge or barrier is even just imagining what a fully adapted future looks like, what it looks like when it's the new normal, and it's not these sort of discrete, independent actions. And I think that's going to be important moving forward to really make it into that sort of much more resilient future at the individual and at the health system level. And certainly engagement and empowerment is really important, but also can be a challenge in terms of the meaningful and inclusive collaboration with a wide range of partners. People with lived experience with climate change, our Indigenous partners, and many others is really quite important. And so our Health Adapt partners faced a number of these challenges. We learned this in a report that's, I believe, going to be released tomorrow. It's our Health Adapt Lessons Learned report. But there are also a number of enablers that they identified as well. So, having very clear objectives about what you want to achieve with your health adaptation, with your resilience building activities. Again, the importance of broad engagement, but also information sharing with many partners. Integrating lessons learned as you go through the health adaptation activities. In this case, it was from COVID-19 experiences that they had to learn many lessons from that. More focus on prevention and preparation, but also adaptation as an iterative approach where you can course correct when you need to. Having adequate staff capacity was identified as being really important, but also having really good guidance documents so that you can undertake the different kinds of activities that you need to, the research activities and the program development activities was really identified as being important. And I think a really great opportunity in terms of scaling up health adaptation is that there's so much more interest now in terms of many different health partners, but even partners outside of the health sector, in terms of the importance of this issue and the need to take action. And so, building on that momentum, I think, is really important. So, health system planners and administrators, healthcare practitioners, physicians, nurses, nurse practitioners, also public health officials, those involved in environmental health and health communication, food inspection, wide range of officials, but also social service professionals that provide a lot of those services that are really important from an upstream determinants of health perspective. So people working in housing services, employment services, children's and youth services, services for people with disabilities. So it's really important to bring them into the tent and into the discussions and into these efforts moving forward. And as I mentioned, a lot of the decision makers from outside the health sector. And the health professionals work with, obviously, with researchers and with Indigenous partners, civil society partners, medical professional groups, and obviously individuals, including those most at risk. And so I think a really important key to moving beyond undertaking pilots is really transitioning into this iterative management of climate change risk to health. So this is a diagram, a figure that we developed for our health assessment based on how many health authorities in Canada address climate change risk to health, starting at building awareness, broad awareness of this being a really important issue, undertaking some of that groundwork, adaptation activities in terms of research, surveillance and monitoring, undertaking assessments. And then once you have that information, moving into some of the concrete adaptation measures, training health staff, improving emergency management in health facilities, maybe upgrading infrastructure in terms of some of these facilities, and then moving into where you have a look and see if you're making progress building resilience, if you're being effective, doing that evaluation and monitoring. So a number of health authorities, I think, are just beginning this cycle of iterative risk management, and it's a cycle that continues into the future, and it really anchors health adaptation efforts, and it should lead to continuous improvement and expanding activity. That's, I think, really the basis for scaling up of health adaptation. And there's a number of guidance documents from the World Health Organization, Pan American Health Organization, and money partners that can be very helpful in all of these different activities. And we've got some from Health Canada for our health partners at the local and regional levels in Canada. And certainly our office is very active on climate change and health. We have our Government of Canada Adaptation Action Plan, which is the federal contribution to the National Adaptation Strategy. And we're really focused in a couple of key areas. One is protecting the health of Canadians from extreme heat. And so we have new investments building upon existing programs that support efforts to enhance evidence-based and develop the evidence-based and develop federal guidance to support actions to make indoor environments safe from extreme heat, because we know that many people die indoors. And so we really need to make those safe for people, particularly those most at risk. But also, we're looking at developing climate-ready heat health interventions and scaling up the implementation of adaptation efforts and fostering heat resilience. But the second major initiative that we have is our climate resilient and low carbon health systems. And this is really a renewal, really exciting, a renewal of our Health Adapt program, the one that was first launched, as I mentioned, in 2018. And so we're going to be renewing that, expanding with resources and guidance, data and information. And we have a new set of partners, funded partners that are undertaking projects that, again, we're all going to learn from moving forward to help us scale up. And as part of these activities, we are looking at actually scaling up and sort of moving beyond that pilot process and scaling up specific interventions to reduce the health impacts of climate change, but also assessing the effectiveness, as I mentioned, of existing interventions, and looking at interventions that simultaneously protect health, but they also reduce costs and they improve sustainability. To kind of get into that sort of mainstreaming climate change into more and more health programs and seeing how we can help health partners do that. So a really sort of exciting time for us in terms of scaling up some of these activities. And so, just before I end my presentation, I thought to just highlight a really interesting example of, moving from pilots to a whole of society sort of resilience approach. And this is, so I think this is a really excellent example of scaling up. It's based on using climate and weather information to mainstream adaptation activities that can really protect health. So this is new guidance that was developed by the National Program for Play Area Safety, and it was sponsored and supported by the Standards Council of Canada, but also our office at Health Canada as well. And it includes these really, I think, very interesting tools. A guidance on designing climate-ready playgrounds for children. And within that guidance, it has a playground report card that has sort of a checklist of what kinds of things are really important when you're designing a playground. For example, to remain cooler during an extreme heat event. Make sure you have shade. Make sure that the materials on the playground structure don't burn children, don't get so hot that they burn children. And so this report card is available, but they also have an infographic that can help with communicating this information on why design for thermal comfort at playgrounds. So, this is, I think, a really great tool for communities, for schools, for centers that host children, to make sure that they're safe from some of these climate extremes. And so maybe just to a few last thoughts in terms of scaling up to get ahead of the climate change curve. So I think it's really important for health authorities to be very proactive in our risk management efforts. And again, we can't get caught in an ineffective cycle of responsive or crisis adaptation. Super important to engage with colleagues and empower partners and take advantage of the growing interest and the growing actions by many partners in the health sector, and again outside as well. And to contribute to networks of health professionals through education and training. And this is a wonderful example, I think, of that. But also, we really need to employ iterative adaptation evaluation based on evidence. So we really can't afford to be ineffective as climate impacts increase. We may actually have fewer time and resources for health adaptation planning in the future. And so really need to think about that and to be able to course correct quickly when we have to. And it's really important to seek to build individual and health system resilience by achieving co-benefits of our actions. When we undertake adaptation measures or greenhouse gas mitigation measures, how can we be supporting and benefiting health as a co-benefit? Things like increasing health equity, reducing chronic diseases, improving mental health, because that's going to build general resilience in society to these impacts and really support our efforts to make people safer when these impacts from climate change and the risks increase. So really quite important to design these measures correctly, and certainly to make sure that we're not harming health when we design and implement these measures. So with that, I'll just say thank you so much again for the invitation, and I really look forward to the discussions. Thanks.
Thank you very much, Peter, for a great tour de force of the experiences you're having in Canada. I certainly learned a lot and a lot of ideas for how we need to approach things. Our next speaker is Professor Barcelo from the Fiocruz in Brazil. Christopher, over to you.
Thank you for the invitation. I appreciate the idea of the course. It's very, very, very interesting, and I hope to address some of the questions. Very difficult for me because posso shift to Portuguese, please? Posso?
Yes, you're welcome.
Eu vou colocar foco especial na questão
Actually, I will place a special focus in terms of observation, data on local observation, And in other words, I will be talking about scaling up an observatory of climate and health. I'm part of the Brazilian Observatory of Climate and Health that has celebrated 15 years of existence. And this, how to scale up, this is a continuous and permanent problem or issue for us. First of all, and maybe I would like to bring to you some of the definitions in terms of how to scale up a health adaptation program or measure. This is, at the same time, this means gaining diversity, uh, actually trying to reach the largest possible number of problems and having to have a lot of staff and also gain scale in terms of both scope, reach in terms of, of geographical scale, and also have a higher level of impact. In other words, having a more public coverage and efficacy, as Peter mentioned a minute ago. And that places under the spotlight this divorce existing between local and global initiatives. Or there are issues which are very particular, like said by the epistemology. There are some specific things and other things which are global, universal, if you will. At local level, we use pretty much qualitative data based on experiences and perception, or perceptions in general, and at the global level, we use quantitative indicators based on quantitative elements or things based on indicators. In other words, we will have a higher intensity of participation. The main collaborators, they are usually associations of the civil society. Meanwhile, at global level, we work with technology and institutions in general. At local level, all the different studies, all actions are highly dependent on the context, and those contexts are plenty, especially based on the scenario that we live in terms of climate change and climate crisis. And there is a sentence which is very much, or a statement which is very much repeated. People say that the statement is the evil is in the details. It lives in the details. Where to start? Details are important, but an attempt of generalizing things, that becomes a problem. When we work with the community, for example, we hear very much testimonials or statements that are hardly measurable because they represent, well, personal feelings or the sufferings on the part of the people, their perception of their values on the part of the communities, which are very specific. But at the universal level, at the more general level, we need to measure. We need to measure based on data that are scientifically valid and also the data that are available. So we have to abstract ourselves in some way out of all this knowledge which is generated or which is accumulated at local level by the communities. But at the same time, when we do produce something which is part of a wider universe, we need to highlight the pertinence and also the relevance of the problems that we are facing.
A good example when we work with climate change. As a matter of fact, we've been affected here in South America, and that has their consequences in other continents and other countries. And we talk to people, and they say, how do you feel? Of course, people suffer. People have their own feelings and their own opinions about it. But thinking about in the environmental aspect, we have to think about those vectors or what carries dengue, for example. So we have to do some sort of collective work and think about not on the disease itself at individual level, but we have to think about all the consequences in the environment. And of course, we have to use statistics and we have to use big data. That is why this transfer of knowledge is so difficult, because for us at global, national, regional level, we always work with the meaningful indicators, the incidents, the anomalies of the weather, of the climate. But people, they might not really have a grasp of that little fact that affects the day-to-day battle of entire populations. So what we do is to use those simplistic conceptual models. You relate one variable, many a times a temperature, with some sort of something that affects us, the death or disease. So that generates this weather anxiety, as we've several times mentioned, and it has that feeling that they don't bring us any solution. So this simplistic model, this type of approach, is heavily laden with catastrophism, and it hides the inequity that exists in the impact of the climate change on our health. So what can we do to protect those populations? This is a question. Of course, there is a more complicated aspect, but still think that it could be very useful to try to relate those factors. When we talk about the climate crisis, let us talk about the drought. A drought reflects or causes water scarcity. People start looking for water sources, and they might be contaminated, and so they get infected, or they use some reservoirs that are, as a matter of fact, used. As a matter of fact, it is where the mosquito multiplies. That would cause diseases, infections, more or less severe cases that will affect the hospital system, health system, and that goes on local media, local newspapers as such. So we have to understand the entire picture for us to know exactly where to work on. First, where to get indicators from. So it is possible to measure, for example, water levels on the reservoirs or the rivers, either superficial waters or the water bad, the availability of water in the nature, but about the contamination of water. This is something that we can measure. And of course, data with regards to admission to hospitals. And of course, news in the media. Of course, that might be important sources of information so that we can collect an entire set of data for us to analyze our crisis, and of course interfere on with regards to the health. But there are sometimes pockets of information, and so we are using different indicators that could be elsewhere. So let's talk about the climate crisis, for example, which is the health attention, comorbidities, conditions, general health status of the population, nutrition, and all that inequality, all those aspects, and also notificate the primary health care. So this entire scheme is based on what the community indicates and points out where things are, or where things are happening, and where is the aspect that requires more attention. For example, workshops are so important. Local news and statistics, and also field work, all that counts on the participation of community, and they are very important tools for us to consider the local and global context, what it is universal or what it is specific to a certain community. A very dramatic example is a drought that we had in the northeast of the country, of Brazil, and it is, yes, possible to measure and monitor the drought or rain by the NDVI, which is the normalized difference vegetation index. In kind of pinkish, it is where you are more affected with the drought, and green, less affected. And there is an area that for long periods of time, droughts stretch for 2-3 years. And this is the example of what happened in the state of Alagoas. And of course, combining this piece of information from this vegetation index, the IDVI and DVI, with data about health, and of course, with news that we get in the media, we have a more complete picture of what it is happening. There is a drop throughout the last along the last few years of our NDVI, so showing the trend of droughts getting more intense for long periods of time in entire region. And there was a peak in 2013, 2014, and combined to several deaths caused by diarrhea. And so those were the pieces of information that we used to work out on the picture of the crisis, and for us to be able to interfere and leverage aspects with regards to the health. So the practical consequences in terms of scaling that up was to create a drought monitoring system in this semi-arid region in the northeast of the country that shows us on a weekly basis the evolution of this the drought index. I'm not talking now about the NDVI, but it is another index that it is being used for, so that we can monitor and observe a drought in that area. So this is the picture. No water. The little water they have is totally contaminated, and sometimes used by the animals, and sometimes they are used by for human consumption in the rural areas. And of course, those rural areas are affected, and populations are affected by diarrhea. So this connection of what we observe through the interviews and in the workshops and going to the field, and of course combining with the indicators of what they tell us, that is what we call scaling up. Now, this is our website of our observatory, and we have data and also news and about the more generalized crisis that we've had in Brazil. And this is a map that can be used for consultation. So in this case, I'm showing dengue map, and you can see that it is spreading out to the south of the country, and of course reaching Argentina and Uruguay as well. We're talking about dengue. Now, you can see that we can analyze and graphic form the evolution of those diseases, and of course the location, in this case the municipalities, and also data about demographics and health system, health centers and facilities. Now I would like to now mention and highlight 5 crucial important factors for us to do to monitor, better saying, and to observe this climate crisis, and of course to address those conditions. So data. It is not only one indicator. It is not only one point of view about an issue, a problem. We have to gain this possibility of being more diverse on the way we look at the problem, we look into the problem. And second point that I make here is to get information on the health and socioeconomic situation of those vulnerable populations. Going to the field, working, and doing our workshops, conducting our workshops with participation of the population. And of course, the intensive use of our analysis. Of course, we have to move away from the prevalence of diseases and temperature and the average temperature of between this month and that month. We have to identify what the trend is, and of course, to detect trends and the outbreaks and the climate anomalies using the science that we have. And of course, we have to form a network. We have to work together. It is very important to train people to conduct studies using our observatory, of course. There are several disciplines that have to look into a health problem that is related to the climate changes. That would create a critical mass at national level for us to understand the problem, understand the details of it, and finally, last but not the least, the commitment of local groups with who would interpret all the information and bring solutions. I would like to pose a question, and actually we'll have that question at the end of this course. The question is, how could we study and analyze all those climate variations and how to convey the best way we can information to community organizations? What does 1.5 degrees Celsius and what does that represent to the community? What it is the difference of 300 per thousand to 800 per thousand cases of dengue, and how to make people really multiplied and pass on the information, understand the processes, and to explain the meaning of those variables. We have to try to translate those figures. For example, water levels in rivers, animals that disappear from a certain area. And so include not only those indicators and not think about only temperature. Of course, it is important, but we have to think about other aspects that may increase or decrease risks to our health. And of course, we have to listen to local communities. We have to listen and understand how they feel about it, what they observe, and of course, foster this understanding about those climate processes. Of course, we have our own language, of course, and there are different definitions that are hard to explain to a community that has an issue and they live in that situation. Of course, those are questions that I'd like to just suggest to leave them open. Of course, there's no yes or no or correct answer to all of those, but it is very important and valid to think about all those when we talk about the issue at local level. And of course, when we think about the technology, when we want to create this a sense of participation and this transfer of technology and knowledge along with community participation. Thank you very much, and thanks for the attention.
Thank you very much, Professor. That was, for me, very stimulating. I am an epidemiologist, and the discussion about local versus global, qualitative, quantitative, excellent. And you provided examples of the complexity of climate and health, and how do you join up the dots? How do you communicate to people what this all means? So thank you very much. Our next speaker is Mary Cameron, the director of the Climate Resilience Unit in British Columbia in Canada. Over to you, Mary.
Thank you so much. There I am. Please let me know if you can see my slides in full view.
Yep, looks good.
Great. Thank you so much. Hello, and thank you for the invitation to be part of this important course. I'm Mary Cameron. I'm the founding director of the Ministry of Health's Climate Resilience Unit here in British Columbia, in Canada. Before I begin, I would like to acknowledge with deep gratitude and respect that I am joining from the territory of the Lekwungen peoples, including the Songhees and Esquimalt First Nations, who have cared for and stewarded these lands since time immemorial. Here in what's known as Canada, today is the National Day of Truth and Reconciliation, which is a day where Canadians honor the survivors of residential schools, their families and communities, and the children who never came home. And on this day, we wear orange shirts in recognition that every child matters and reaffirm our commitments to reconciliation, including the United Nations Declaration on the Rights of Indigenous Peoples, which is now enshrined in federal and provincial legislation. In my presentation today, I'll be sharing our journey to scaling up health adaptation within the provincial health system here in British Columbia. I'll be presenting from the perspective of the Ministry of Health, which plays a provincial stewardship role, but I really want to acknowledge that it's our partners in the health authorities and our communities that are doing the heavy lifting in this work. I'll be sharing examples of how our health system is scaling up action, and I'll review some successes and setbacks, as well as steps that we're taking to build momentum into the future. So first, just briefly, a little bit about our climate resilience program. We were formed in 2022. We work with health authorities to steward a coordinated and streamlined approach to climate change and sustainability across the provincial health system. And we also collaborate with other sectors and partners as part of an all-of-government, all-of-society approach to building a healthy, climate resilient, and sustainable British Columbia. Our health adaptation journey here in BC has been very rich, but in the interest of time, I'm going to highlight just a few of the key developments and milestones over the last 5 or 6 years. And I've focused on adaptation here, of course, for this course, but it's important to note that health authorities have been required under legislation since 2007 to reduce their greenhouse gas emissions and to achieve prescribed emission reduction targets. Although health authorities and community organizations have been laying the groundwork for many years, provincial scale health adaptation really started to accelerate in 2019 with the first provincial climate risk assessment, where health was identified as a priority sector facing unique and significant risks. That same year, amendments were made to the Climate Change Accountability Act, requiring public sector organizations, including health authorities, to manage and report on climate risks to their organization. With support from a national funding program, so the Health Adapt program that Peter was speaking to you about, some health authorities in our province secured short-term funding to kickstart regional adaptation projects between 2019 and 2022, which really helped to spark and catalyze action. In 2021, the province was developing its first climate preparedness and adaptation strategy when British Columbia was hit by a series of unprecedented extreme heat, wildfire, and flood events that had devastating impacts on population health and our health system. And when this strategy was launched in 2022, health was included as a core pillar. And we formed our climate resilience unit here at the ministry to coordinate the health system's contribution to the strategy. In the following years, we developed the Ministry of Health's first climate action plan and led a provincial review of climate impacts to health in the health system, and supported health authorities to develop their own teams, capacity, regional assessments, and climate plans. And today we are focusing on the development of a system-wide climate change and sustainability plan, which coordinates the climate plans across our province and across our agencies. So what does scaling up look like? For us, scaling up has taken many forms and has not followed a simple, linear, predictable trajectory. In fact, some of the greatest leaps have really come from opportunism. So for example, the Provincial Climate Preparedness and Adaptation Strategy presented a unique opportunity for us to advance foundational health adaptation actions and set the stage for more incremental scaling up in the years that followed. So this included moving from isolated pilot projects in select health authorities to securing ongoing base funding for our organizations. It included shifting from department-specific adaptation plans to cross-organizational plans that bring together actions across multiple streams of climate action, including emissions reduction, adaptation, sustainability, and planetary health. Scaling up has also meant breaking out of our silos. So working with other sectors and partners. And this is because some of the most important changes that need to occur lie outside the health system realm of influence and authority. So talking about those upstream social determinants of health is really critically important to be working with those partners. Of course, health is also a unifying value that's universally shared across many sectors and partners. So this presents an opportunity to leverage your respective efforts, pool resources, amplify your vision, and extend the scope and reach of your work. Finally, it's critically important that climate action does not remain on the sidelines. So while opportunism can help to catalyze your efforts to scale up, a more sustainable approach requires hardwiring climate considerations across all health policy and practice, and likewise embedding health into climate policy and planning in other sectors. So my last slide talked about what needs to be scaled up, but figuring out how to scale up is not easy. Hence the purpose of this course in this session today. So how do you go from climate action off the side of your desk to broad scale action across an entire health system? Of course, we are still learning and we have a long way to go, but I can share some of the most impactful levers and pathways that have helped to accelerate action in our province. And the hardest part was really knowing where to start. So tackling an issue as big as climate change within a complex health system is that's already overextended. It is quite daunting. In our experience, a critical first step was understanding the system and the landscape. So this began with informal conversations and building relationships. In fact, Peter Barry was one of the first people I called when we were forming this program and this work. And led to a fulsome provincial baseline capacity assessment to identify and document the existing strengths, gaps, and opportunities. And drawing on the World Health Organization's framework for building climate resilient health systems, this process engaged health system partners at all levels, from decision makers to frontline staff, to understand their needs and realities. This slide presents some of the most critical opportunities identified in that assessment, and there were many, many others. In our experience, these don't necessarily occur in a particular order. And for us, they've really been happening in tandem, each moving at varying paces. So accountability means having a clear mandate, which serves as a critical anchor and lever to scale up action. And of course, to deliver on these accountabilities, you need leadership and workforce capacity. For these teams to work in concert, you need governance structures to enable and oversee a coordinated approach across the health system. Governance structures enable you to build out plans and strategies, and in our experience, this began with organizational level plans, and now we're working towards a cohesive plan that strategically links these plans to be working in concert at a system level. And networks are listed last on this slide, but I would say networks are arguably the most important and key ingredient that carry you through every step along the way. So in our case, this began with a few informal phone calls and conversations, but today we're grateful to be part of a large community of allies and champions that are all working towards the same vision and a shared vision together. So in the following slides, I'll provide some examples from here in British Columbia. So starting with accountability, the Climate Change Accountability Act here in British Columbia sets clear requirements for governments and for the government and public sector organizations, so including the ministry and health authorities. We're required to be carbon neutral, to meet provincial greenhouse gas reduction targets, and to manage climate risks. Under this legislation, we're also required to publicly report our progress through annual climate change accountability reports. And these accountabilities are reaffirmed in the ministerial and health authority mandate letters, which require health authorities to implement and report on climate plans and strategies. We also lead health actions under broader provincial strategies, such as the Climate Preparedness and Adaptation Strategy, where we committed to foundational actions to shift BC to a low-carbon, climate-resilient health system. Earlier, I spoke about the importance of understanding the landscape and the system that you're working in. In 2024, we published our Risk to Resilience report, which is a provincial review of the health impacts of climate change in our province, including data and real-world stories from partners within and outside the health system and from the communities that we serve. You can access this report by scanning the QR code on this slide, which will take you to our new dedicated health page on Climate Ready BC, which is the province's online portal for information on climate readiness and disaster risk reduction. This review reiterated what we had learned in our baseline capacity assessment, that scaling up requires accountability, leadership, governance, strategy, and networks. And generating and mobilizing knowledge through reports such as this one help to inform evidence-based action that's locally and culturally relevant and to build the business case to scale up. It can also be applied to develop knowledge products, resources, and activities that convey a compelling story that's going to resonate with diverse audiences and builds that shared understanding around key issues and why they matter. Importantly, generating knowledge and evidence must move beyond Western scientific perspectives to reflect stories of lived experience and Indigenous worldviews. These key enablers have also informed the following core functions of our climate change program. So with respect to governance and accountability, this includes our Ministry Executive Committee, which provides oversight for our Ministry Climate Action Plan, workforce and training and development. For example, we're developing an online training course and leadership programs that are tailored to the BC Health workforce. Evidence and communication includes those assessments and knowledge translation activities and products. And innovation and transformation. For example, we have a climate innovation program that provides seed funding to health authorities and their partners to test and evaluate novel approaches in real-world healthcare as well as community settings. These factors also show up as the key enabling pathways in our health system's climate strategy. So the Climate Change and Sustainability Plan articulates a unified vision and shared goals across the Ministry of Health and health authorities, formally linking our respective plans so that they're working in concert and that they're aligned with climate goals and priorities of our provincial, national, and Indigenous partners, as well as the needs and realities of the communities that we serve. So working with health authorities, my team will serve as the coordinating body for the plan's implementation, including interagency governance and reporting structures. So today I've reviewed some of the highlights in our adaptation journey, but I've largely glossed over some of the messy parts. And I do want to be clear that scaling up health adaptation is not straightforward. It's not a linear process, and it can involve many ups and downs. So here I've tried to distill some of the key success factors as well as the setbacks that we've experienced here in British Columbia. So with respect to success factors, this includes understanding the system and the landscape that you're working within and the current state. So understanding the priorities, needs, and realities of decision makers, partners, and diverse communities. Communicating what you've learned into a compelling story and vision that resonates with diverse audiences that need to be part of the solution. Building a climate smart workforce and a community of champions and allies around that vision for a collaborative all of society approach. And leveraging those co-benefits, optimizing the multi-solving potential of this work, which can reinforce goals around economic sustainability, Indigenous reconciliation, and health equity, to name a few. Some of the challenges include, of course, navigating an issue like climate change within a complex system is not easy. It requires shifting away from siloed short-term mindsets to future-oriented systems thinking that's essential for true system transformation that's grounded in health equity, cultural safety, and the needs of future generations. Ensuring our health system has the necessary knowledge, skills, and capacity is an ongoing challenge, particularly when it comes to facilitating the shift from theory to practical applications. And finally, competing priorities with limited resources. And this goes back to understanding and remaining responsive to the needs of the system and the diverse communities we serve, which are not static and are ever evolving. Looking to the future, what are the key challenges and the opportunities that we're focusing on right now to continue building this momentum? Well, we're working to harmonize across multiple streams of climate action, including mitigation, adaptation, and sustainability. We all have a shared goals and outcomes that we're working towards. So really leveraging that to harmonize those streams of action across multiple teams and departments. So this includes facilities, public health, emergency management, clinical operations, to ensure that we're strategically linked and coordinated around a unified vision and common goals. Streamlining governance and accountability can support this, while also enabling us to be more attuned and responsive to the shifting barriers and emerging priorities. And this attunement is critical to remaining innovative and adaptive, especially in this time of fiscal constraint and economic uncertainty. So this enables us to optimize the value and impact of our efforts. I'd like to thank you again for the invitation to be here today and to share our story with you and to learn from the experiences of other health systems. So thank you again, and I'd be happy to take any questions.
Thank you very much for that, Mary. Again, I thoroughly enjoyed your sharing. From the being opportunistic in a context of being strategic, joining up silos, and giving us guidance or some suggestions on where to start. And you concluded with some of the success factors and some of the challenges, including mindset. I find that's a difficult one. I'm here in Washington dealing with a lot of ministers, and some of them are like, still, climate affects health? How? And, so people are at different points in their journey, and you have to be able to meet them where they are and help them see, and then they engage with you. But now we're at that point where we can have some questions and answers. Now, there are a lot of questions. So uh, my colleague Maggie and I have been looking at them and trying to pick out a couple of questions for each of you as panelists. And I'm going to start with you, Peter. Um, and ask you about, Canada has a long history of scientific leadership. Given the scale of what we face in these challenges, how can the international community move beyond fragmented nation-centered responses? So we're talking even bigger now. And do you see this as a moment to advance towards a more binding and equitable global governance framework that ensures accountability and prioritizes humanity's health over more narrow political and economic interests? So that's a big question.
I was just going to say that is a very big question. I mean, I guess in terms of the science aspect of this, and this is what I heard in both of the presentations, that it's so important for the science and the evidence to be used to inform the needed policies moving forward. And I think internationally, there's a lot of opportunity in moving forward to be able to do that, to develop the some of the needed research, but also in forums like this to learn from others. So certainly Health Canada has benefited from a lot of international collaborations over the years, many years actually. So for example, we contributed to some of the earliest guidance for doing climate change and health assessments led by the WHO and by PAHO. And that's helped, I think, a lot of health authorities in Canada and outside of Canada get the information needed to really support effective actions and actually to bring the awareness to many people how important climate change is when you have that evidence to be able to move these actions and needed actions forward. And I know there are opportunities through the the Attach initiative, the Alliance for Transformative Action on Climate and Health that the WHO leads, to continue a lot of this exchange at the international level on research and best practices, and so we're quite involved in that as well. So lots of opportunities, I think, to move this forward.
Thanks, Peter. And then I'll pop a second question at you, which has come up a couple of times. Could you provide more information on strategies for Indigenous people?
Yeah, for sure. Well, we were very fortunate in our national health assessment released in 2022 to have a separate chapter developed by the National Collaborating Center for Indigenous Health on climate change impacts on Indigenous peoples living in Canada. And that reported on a lot of Indigenous-led research, but also Indigenous-led adaptations that have been completed, and that I think many people, health authorities across Canada, learn from. And so there are, different types of adaptations, and certainly the Indigenous leaders can speak much better than I can to this. And so I would encourage people to read that chapter. I'll put the link in the chat. But some of the really significant issues that are being faced by communities, for example, in the north, in terms of very extreme weather that makes it harder to hunt, and the weather is much more unpredictable. There are different types of adaptations that have been developed for that. Or in terms of food safety and security as well. There's a lot of different measures and learnings that have been developed at the local scale, and within different communities for doing that. So many of them. And so again, I'll put the link in the chat, and I would encourage people to have a look at that. Yeah.
Thanks, Peter. So now moving to you, Professor Barcelo. What can be done when the available data are very limited and do not allow us to identify other vulnerabilities of people during an extreme event? And beyond the event itself, pre-existing vulnerabilities and access to care can also play a role. So how can we engage with the authorities in dialogue on this context, given that participation of people in climate change and health policies is already a challenge?
Muy interesante. Creo que nosotros tenemos alguna experiencia también con otros países de América del Sur
We also have
casi todos
some experience of this with
disponen de
some
datos.
South American countries, and they all have data,
El sistema de salud. Y esto pone
regulatory data
un desafío muy grande que
from the health
cómo
system, and
comprender
this
lo que
entails a
pasa
huge
una
challenge.
población muy grande según los
How we
datos
can understand what
del Servicio
happens
de
in
Salud.
a
Sí,
large
porque
population
no todos
according to
usan,
the
no todos
health
están capaces
system
de acceder
services,
a los servicios de
health
salud.
system.
No todos se ven representados por los
So
datos
not everyone
demográficos.
feels or is included in demographic data, but there are some strategies, some statistical strategies that can be used, for instance, to detect outbreaks. Outbreaks are almost always visible. It's usually the local media that can spot them in a small city. Small cities have their own newspaper. They have information about very serious events as well. And also, we can address this from a statistical perspective. And this is why I mentioned data mining, because we can manage large volume data, big data, and really see or determine which are the affected groups according to neighborhood, etc.
Una información completa ni abrangente, pero creo que es una posibilidad de diálogo. Un diálogo que
it's not complete or very comprehensive information, but it provides information, and then we are going to interpret what we see with the data. For example, if there's a very serious outbreak or an extreme weather event, and we can detect this with the statistical processing of epidemiological information, then we are going to look for sources of information at the local level so that they can provide details on what happens at the local level, what's the population that is affected, what happened with this, all of the components that make up the complexity of this at the intersection of climate and health. And so starting with quantitative information and going towards local information, that would be an alternative.
Thank you. And so I have one more question for you, and I think this is almost a broader question than just climate and health. But in thinking of the observatory and scaling it up, what comments do you have on the analysis of results and indicators to better relate to political authorities in the decision-making process?
También una cuestión muy complicada porque el sistema de salud
Well,
en
that's
Brasil es muy
also
descentralizado.
complicated because the health system in Brazil is very
Algunas
decentralized.
iniciativas sí
So some
tienen
initiatives
reflejo en el nivel gubernamental local,
have
otras no.
are at the
Brasil
local
como casi todo el
level,
mundo,
and
Brasil
so
divide
just like
dos polos muy
elsewhere in the world, Brazil is
confrontables, que son los que
polarized.
creen que hay un
We
cambio
have
climático,
those who
que
believe that there
hay
is
que invertir
climate change, that it
políticas
exists,
sociales,
that we
y
need
otros
to
que no.
invest on
Este mundo sí se cree que
policies,
la prensa y las
and some
asociaciones, las
that
sociedades
don't.
civiles tienen un
And
un
I
rol muy
think the
importante
media and civil
poner
society
presión
has a really important role
las
to put
autoridades
pressure
locales.
on local authorities.
Y siempre una visión regional. Por
And
ejemplo,
always having a regional
municipio
perspective, for example, a municipal local government that doesn't have an adaptation plan to climate threats, next to another one that does have a more protective perspective. I think it shows a really significant contrast. And so having regions and working, including all municipal governments, regardless of the political party of the mayor, you know, areas that are more susceptible to droughts or to floods, we need to think beyond the local government. That's what I think.
Thank you very much. So now I'm going to switch to you, Mary, and both of the questions concern collaboration and partnership, really. Do you have any advice on how to collaborate with all the relevant partners as early as possible?
Yeah, great question. It took us about a decade before we got to a place where we had a dedicated program and plan for this work. But along the way, understanding and engaging with partners in other sectors and understanding the needs of communities has really been critical to understanding that landscape and that system that we're working within. So the Ministry of Environment and Climate Change Strategy actually reached out to us very early on because they recognized the important health benefits of climate adaptation and the risks that the health sector and community health was facing. So that sort of goes back to that unifying value of health. It's something that everyone cares about. Everyone wants to live a healthy and prosperous life and to have healthy families and communities. So I think understanding and connecting in with those underlying needs and priorities and motivations in this current context in particular, when there are many competing priorities, we need to be honing in and understanding how how climate change is intimately affecting the lives of people in our region and various decision makers. So there are economic and social benefits of climate adaptation for decision makers in the health system who for many years felt that climate change is something that the Ministry of Environment does, and why should the Ministry of Health be playing a role in this space? We see during climate-related events, extreme heat, wildfire, and flooding, that it's critical that our health system is prepared to be able to continue to deliver high-quality health services to the population when it needs it most, and that our facilities are resilient to these risks. So understanding the risks and costs of inaction is really critically important, but understanding the personal needs as well of the public and the communities that we serve, to understand their motivations and ensure that we're responsive to that. Because if we are too disconnected and focused, sometimes we get so focused on the science and the evidence, and we lose sight of what really connects people to this work and what comes close to home. So understanding those needs and priorities and having those trust-based relationships that you're building early on is really critically important.
Thanks for that. And I'm glad you actually said it took many years, 10 years, to get to a certain point. And then at the beginning, people in health said, oh, this is an environmental problem. So regarding coordination from partners such as Ministry of Agriculture or Urban Development as may be needed, how did you navigate this? And could you please elaborate more on any of the governance and partnership structures that worked best for you?
Mm-hmm. That provincial climate preparedness and adaptation strategy that was led by the Ministry of Environment was a critical catalyst for a lot of those partnerships, because it was a cross-government strategy. So Ministry of Environment brought together health and agriculture, forestry, diverse sectors, transportation to join together on this strategy, and had supporting governance and accountability structures to bring us together. And that enabled the creation of connections and pathways so that we could begin having those conversations and understanding our respective worlds and sectors and needs and priorities. So through those provincial level committees and structures and accountability mechanisms, we were better able to understand how climate change is impacting our food systems, food security, mental health, and understanding where specifically our role and realm of influence can lie, but recognizing the limits of that realm of influence as well, so that we can know who to reach out to build those partnerships, because a lot of this work is very complex and multidisciplinary and multi-sectoral. So we need to know who has what levers and where to connect the dots. And so having that governance structure has been really important. And then we developed our own governance structure and accountability mechanisms within the health system. So the health authorities report to and are accountable to the Ministry of Health, and the climate leads across each of the health authorities report into us and help us to understand what's happening within the system and on the ground. And likewise, my team can be working more at the system level to be building those bridges and connection points with other sectors, other ministries, to be creating that enabling environment for the health authorities to do the work that they need for their communities and their organizations.
Thank you very much, Mary. Well, I cannot repeat all the things in the chat, but there's lots of appreciative comments for the talks today. So thank you again, Peter, Christovan. Thank you, Mary. And Maggie has posted some notices in the chat for your attention. Please join us again on Thursday when we would have session 3 in this course. Thank you all very much, and good afternoon, bon après-midi, buenas tardes a todos.
All right, thank you. Congratulations for everybody.
Thank you.
Yeah.